In March 2020, the rapid spread of COVID-19 across the globe had begun to spark fear in many nations. In the UK, the Guru Nanak Nishkam Sevak Jatha, an organisation founded on selflessly serving humanity in the name of Guru Nanak, founder of the Sikh faith, started to discuss how best to protect their congregation from this growing threat. The first response was prayer, as the Gurdwara conducted a continuous recitation from the Guru Granth Sahib Ji, which culminated in an edict focused on placing all hope in the Almighty. On a practical level, the Gurdwara began to encourage self-isolation, social distancing, and for the vulnerable to stay at home. As the threat in the UK rose, the Gurdwara took the difficult decision to close its doors on the 21st of March 2020, a day before the lockdown was officially imposed by the UK government. Suddenly, thousands of daily visitors found themselves stuck at home, scared and without access to the sanctuary they had heavily relied on for over 40 years. In our globalised world, the COVID-19 pandemic was a disaster of colossal magnitude because of the thousands of tragic deaths it caused, millions of livelihoods lost, and the crushing economic effects. The impact of lockdown uncovered and exasperated anxiety, fearfulness, misery, untold mental pain, and human suffering. During this unprecedented time, the Nishkam group of organisations prioritised genuine consideration for the most vulnerable and needy in society, valuing and paying tribute to healthcare workers, teachers, and all other key workers, combating the escalation in social problems such as fraud and criminal exploitation, and addressing the effects of mass unemployment, homelessness and poverty, which the government emergency measures brought in their wake. The pandemic put a mirror to our human condition. By confronting us with our mortality, it pushed us to think more deeply about life's meaning and purpose. By revealing the accumulated result of our failures, our short-sightedness and irresponsibility in taking care of this world, society was prompted to try to live with greater wisdom and virtue. By spreading indiscriminately, the virus highlighted how interconnected and interdependent people are, and the potential that lies in each of us to be a collective force for good. Although the Gurdwara remained closed, funeral services were adapted to allow families to conduct a final supplication outside the Gurdwara for those who had passed away during this time. This involved families staying in their cars and conducting individual prayers before continuing to the crematorium.
Since lockdown began on the 21st of March, approximately 20 volunteers have been ringing 500 Sangat members of the community. These phone calls are just a chit-chat to the elderly or anyone who is isolating or feeling unwell. They are reinsurance phone calls so that we can see if anybody needs anything, any groceries or any essential items. We have a conference call on a weekly basis where members of the Sangat partake in a collective recital of prayers. The members of the community have also taken initiatives to meet on a weekly basis virtually, whether they sing hymns or recite prayers together.
The Sikh Gurus made the act of seva, or selfless service, one of the central tenets of the Sikh religion and essential for achieving ultimate union with God by serving humanity. Nishkam means selfless and forms the basis of the values by which volunteers compassionately care for all with God's grace and with ultimate humility. The practice of food preparation in the Guru's kitchen was adapted to strictly follow COVID-19 guidelines. The Gurdwara became a centre for distribution and preparation of langar care packages for the homeless and isolated members of the community, lunches for NHS staff, meals for food banks, and cooking ingredients for families of school communities who found themselves unable to access free school meals or struggling to cope.
Very much appreciated indeed. It will now be distributed towards the residents within the building so they can have a sandwich with a cup of tea later on and a piece of cake. And some lovely chocolates as well that have been sent and donated as well.
We've just delivered food to the hospitals and to the care homes. And now we're back at the Gurdwara and we're getting ready to load our cars up to take the food to the vulnerable and the elderly in our community.
We've got around 40 families that have said that they would benefit from it. And whilst there are a number of our families that would normally access the free school meals in school or the voucher scheme that the government has set up, about 25% of the people that have requested that support are not receiving any of that. This has been absolutely invaluable for them to be able to keep themselves and their children fed and safe. So we want to be able to support for as long as we can, using the community, both yourselves, other organisations that have offered to support, but also looking at our staff and our families as well.
So on behalf of all of our children who have benefited from your generosity, I'd like to say thank you on their behalf.
The first thing we did was to ensure that all of our children who were vulnerable had food parcels, and we identified families in need that may need that support. We ensured that stationery was sent to any of our children who needed it. We established online learning right from the beginning and made sure that any parents that didn't have access to that, we were able to send them work home through paper-based learning. And we have also done virtual celebrations throughout this time for Easter and Vaisakhi. We've kept in touch with our parents through Class Dojo. We've had regular contact with videos from staff to the children to stay connected. We've been open throughout the whole process for our key worker children through the Easter holidays, the May bank holidays, and now we've reopened recently to more year groups, actually this morning, to reception year 1 and year 6 children too.
The pharmacy team, alongside pharmacist volunteers, have been working together to deliver medication to patients who are isolating or vulnerable during the whole COVID-19 situation. And we've been working alongside our dental team. So if any patients have been coming in with dental queries, been triaging them across to the dental team at Nishkam as well. We've also been working alongside various different care homes who are finding it difficult in this situation to make sure they get their medications on time and how to deliver them to their patients as well, to minimise infection risk and exposure to the patients there.
We were always fighting the inequalities in society and trying to readdress the health inequalities, the social injustice. What COVID-19 did was amplify them and also required us to change our model of working. So our IAG team, who provide welfare advice, provide debt advice, they provide employment services advice and housing advice. We found that the requirement for their services actually went through the roof. We've done a lot of translation of messages and reissuing of messages on behalf of other partners. So what we've actually done with the Birmingham Faith Leaders Group is we've taken their activities online. But this was an opportunity to have Zoom conferences and online meetings, which has allowed this group to engage with a much broader audience, and we found that to be very helpful. We've also seen that the staff that have been furloughed have been able to volunteer and support the mutual aid work that's going on across the city.
Zero Hunger with Hunger exclusively serve in places of education. The countries in Eastern Africa were behind the Western countries in terms of lockdown and restrictions, but soon after, they too closed the schools, which meant that our service had to stop because we didn't want to be part of any issues with spreading the virus, either from city, because majority of our CLODAs and volunteers live in the city and then travel out to the rural locations to go and distribute the food or go and do any administration. So we followed government guidelines, local in country, in Kenya and in Malawi. So we halted the service, but we still have the service going on in the sense that Zero Hunger with Hunger with its own Lunga crops in Kenya, planting started in February. We were there for about 3 months, and it'll be ready for August. So hopefully we'll have enough stockpile of crops so when schools do start again, after the restrictions and the lockdown, we'll have enough food to redistribute in all the schools in which we serve.
Since the pandemic has started, Nishkam SWAT have had the absolute privilege to provide between 8,000 to 10,000 meals every week to those in isolation across 5 cities in the UK. As well as the hot food, we've also provided a collection service of prescriptions, and we've also helped with essential items and care packs.
Local and national efforts to help the vulnerable and isolated were echoed internationally through community outreach. A food bank was set up and regular support was provided to ensure families had enough rations to prevent the need for travelling during this difficult time. As lockdown eased for reopening, the Gurdwara had a weighty responsibility for the safety of the wider community by following government guidelines to help prevent the spread of the pandemic. New ways to practice spirituality through prayer and service continue to be found so that all individual efforts can still combine for the collective good.